Goniometric measurement of hip abduction. Normal range of motion 0 to 45 degrees. Testing position. Place the subject in the supine position and scoot them to the opposite side edge of the bed to allow the limb being tested to be supported as much as possible. Place the subject with the knees extended and the hips in 0 degrees of flexion, extension, and rotation. Keep a hand on the pelvis to prevent lateral tilting and rotation. Watch the trunk for lateral trunk flexion. Abduct the hip by sliding the lower extremity laterally and do not allow lateral rotation or flexion of the hip. The end of the range of motion occurs when resistance to further motion of the femur is felt and attempts to overcome the resistance causes lateral pelvic tilting. Pelvic rotation or lateral flexion of the trunk. The end field is firm. Center the fulcrum of the goniometer over the anterior superior iliac spine of the extremity being measured. Align the proximal arm with an imaginary horizontal line extending from one ASIS to the other. Align the distal arm with the anterior midline of the femur using the midline of the patella for reference. Get your beginning measurement. Take your patient to end range. Palpate your landmarks and realign your goniometer and get your end measurement.